Nasonex nasal spray contains the active substance mometasone ferrate. It is a corticosteroid medication used to treat nasal symptoms associated with allergic rhinitis or other nasal conditions. Indications: Nasonex nasal spray is indicated for the treatment of allergic rhinitis, seasonal or perennial, to relieve symptoms like sneezing, runny or stuffy nose, and nasal itching. Nasal polyps, to help reduce inflammation and symptoms associated with nasal polyps. How to use: Nasonex nasal spray is administered intranasally, meaning it is sprayed into the nose. Shake the bottle gently before use. For adults and children 12 years and older, the usual starting dose is 2 sprays in each nostril once daily. Once symptoms are controlled, the dosage may be reduced to 1 spray in each nostril once daily. Follow a doctor's dosing instructions and do not exceed the recommended dosage. Contraindications: Don't use Nasonex nasal spray if you are allergic to mometasone ferrate or any of the ingredients in the spray. You have active or recent nasal ulcers, nasal surgery, or nasal trauma. Precautions: Nasonex nasal spray may take a few days to reach its full effect. Consistent daily use is important for optimal results. Don't use Nasonex to treat sudden severe symptoms. It is meant to regular preventive use. If you are using Nasonex to treat nasal polyps, it may take several weeks to see improvement. Before using the spray for the first time, or if it has not been used for more than 1 week, prime the pump by spraying it into the air until a fine mist appears. Side effects: Common side effects of Nasonex nasal spray may include, but are not limited to, nasal irritation or burning, headache, nosebleeds. Less common but potentially serious side effects may include increased risk of nasal or throat infections, adrenal insufficiency with prolonged use. It's important to discuss potential side effects with your healthcare provider and follow their guidance.